All right, time for a Vidant Spotlight right now. We live in a great medical community, and we're so fortunate to have Vidant Health here in Eastern North Carolina. I've been acquainting myself, getting to know our next guest this morning from Vidant Health. He is the medical director of the cath lab for Vidant Health, Dr. Rony Shammas, who is here in the studio with us this morning. And you're here on a great day, Dr. Shammas, because we were talking about this bill from the can I start with that? The legislature has pulled the bill about dogs driving, having people drive with dogs in their lap, because they're saying the rationale that the bill was pulled yesterday was that someone came to the legislature and said, well, you know, we have these service dogs that can determine when someone's about to have a stroke while they're driving. That's the rationale for them pulling the bill. Do you buy it?
Well, to start with, I'm actually a dog person, so I love dogs, and I have a little one that I put in my lap while driving.
You do?
Yep,
yeah.
I have a Yorkie.
Yeah.
But I don't buy it. I don't think there's proof for such. Some dogs may be trained to realize after the fact if someone is unresponsive or having issues, but I don't think you can predict a stroke or a heart attack before it happens.
Right. So, this is something new you haven't heard. Service dogs who can actually tell if someone's about to have a stroke. That makes no sense to you.
I don't think you can predict it before it happens. As I said, I think dogs can be trained to recognize some of the symptoms after it happens.
All right, let's talk about some of the things that you see on a day-to-day basis. I was just telling you, my daughter works in a cath lab. She's a cath lab nurse down in Charleston. Correct. So I hear about what you guys do all the time. What's your opinion of the most important thing for people to know when it comes to heart disease these days?
So heart disease, like many may know, is still the leading cause for death in both men and women. And heart disease, fortunately, is very preventable. Actually, it's one of the most preventable serious illnesses that we have. Not having the problem to begin with is a better fix than any treatment we can offer you today. So prevention is key. And knowing what your numbers, your risk factors are, and trying to control them can drastically cut down on your risk.
So what are the risk factors for coronary artery disease?
So there are established and there are hearsay or not so established risk factors. So we're going to talk about the established proven risk factors. Getting older, having a strong family history, high blood pressure, diabetes, high cholesterol, obesity, inactive lifestyle, and poor diet. These are all risk factors.
I assume that there are some things we can do things about and some things we can't. I guess starting with family history, you really can't do anything about that, can you?
Absolutely. So there are what we call non-modifiable risk factors. These obviously include getting older and having a strong family history. And I just want to make a point about family history. There's a lot of misconception about family history. And we see a lot of patients coming, oh, I'm concerned about my family history. Well, the definition of a strong family history that puts you at risk is having a male parent or sibling who's had coronary artery disease, heart attack before the age of 55, or a female parent or sibling who had the same below 65. Anything else is not counted against you, because eventually most of us are going to have something as we get older.
So if you have a father who had a heart attack at age 65,
is at age 65 or 70 or 80, it should not be a strong risk factor against you, no.
Right.
Now, as you said, we can't do much about them, but being aware of that maybe can help motivate you to control the ones that can be controlled.
All right, which of those factors is most common for heart attacks and strokes?
So the ones that can be controlled are high blood pressure, smoking, high cholesterol, obesity, inactive lifestyle, and diabetes. And the most common risk factor is high blood pressure or hypertension. The reason is that hypertension is extremely prevalent, and you may or may not know that 1/3 of the population actually have high blood pressure. And over 50, when you get over 50, half of the population have high blood pressure, and over 80% of the population will have high blood pressure. So it's like getting gray hair. At some point, almost all of us are going to get high blood pressure. And the problem with blood pressure is that it's referred to as the silent killer because we don't feel it. Mm-hmm. So we may not know that we have high blood pressure. And even when we know, because it doesn't make you feel bad, you are less motivated, unfortunately, to get it treated. Now, if you have a bad headache, you will immediately reach for something and take it. But if something is not causing you an immediate problem, you are less likely to do so. Unfortunately, it damages the arteries and it will eventually give you problems.
Dr. Rony Shammas, our guest here this morning, the cath lab director at Vidant Health. Let's talk about smoking. Many people smoke and do not have heart attacks. What's your opinion of how much it really increases the risk? And while you're talking about that, what about people who live with someone who smokes, like secondhand smoke?
Good question. So I actually get a lot of questions about smoking. And I want to be very clear. Smoking is absolutely a risk factor and a very strong risk factor for strokes and heart attacks. Now, I do get this from patients who smoke. They say, oh, my neighbor lived to be 100 years old and he's a smoker. And I tell them, soldiers who go to a war zone are certainly at higher risk than you and me sitting here talking right now. Not everyone, though, dies there. Many come back. So smoking is a high-risk behavior. Not everyone who smokes is going to die from smoking, but many do. And on average, people who smoke will die about 10 to 15 years earlier than those who do not smoke. It is estimated there are about 5 million deaths worldwide from smoking. 1.5 million are related to heart disease. It's also estimated that 1/3 of heart attack death can be traced to smoking in this country here. Now, as far as secondhand smoking, it is also harmful. Actually, secondhand smoking is estimated to cause about 40,000 deaths per year in this country. And it does increase your risk of having heart attack and stroke by about 30%. Actually, last few years, some countries in Europe banned public smoking. And in the year or two that followed that, there was a significant drop in sudden cardiac death and heart attacks. So again, that's shows you that it is important to prevent secondhand smoking.
You mentioned with one of the risk factors being cholesterol, and when I go to my family doctor and get my numbers, my number always looks really good. My cholesterol number, I don't ever have high cholesterol, but then there's the HDL and the LDL, and it becomes very confusing. And my doctor will say, well, one of them is too low, and you want one of them to be low, you want one of them to be high. It's confusing. Can you explain the difference in cholesterol and how those become risk factors as well?
Absolutely. So there are two main components of cholesterol. There's what we call the bad cholesterol, which is LDL, and then there is the good cholesterol, which is HDL. LDL is a particle that picks up the cholesterol from the bloodstream and takes it straight to the blood vessel and puts it in the blood vessel. So it increases the buildup of plaque. HDL, or the good cholesterol, actually takes that cholesterol from the bloodstream and carries it all the way to the liver where it gets disposed of. So usually high LDL is a bad thing. Low HDL may be a bad thing. Our focus in medicine is to lower the bad cholesterol, or the LDL. Lowering LDL, treating cholesterol can reduce your risk of a heart attack or stroke by about 30 to 35%. Now, current guidelines recommend treatment for 4 groups of patients for cholesterol. First group is people who have had a heart attack, coronary artery disease, stents, bypasses. All of these should be treated. Second group, diabetics. All of diabetics should be treated. And the third group are people who, if you plug into a certain formula, certain aspects, you can calculate their 10-year risk of having a heart attack or a stroke. And if that risk is over 5%, then you should be treated. Now, all these 3 groups, you should be treated regardless whether or not your cholesterol is high. So even if you have, quote-unquote, normal cholesterol, being on a statin will prolong your life, reduce your risk of a heart attack or a stroke. And the 4th group are those who have very high LDL, which is over 190. Then you certainly should give them a statin. One final word about this. Treating your cholesterol, it looks like it's not just lowering the LDL or the bad cholesterol, but how you lower it. And the only thing that works to reduce your clinical risk is lowering it with a statin, not with a different type of medicine.
Right. Those statin drugs work, but they also have some side effects sometimes, right? That people don't. But if you've got high cholesterol it seems to be the belief these days that that's the best way to go, right?
That is the best way to go. Again, as I said, in these three groups I mentioned, even if you have normal cholesterol. And I think the potential side effects of statin is overstated because randomized controlled trials really do not show significant risk or even side effects or intolerance even to statin.
Interesting. Hear you say that. All right, let's move on. You mentioned diabetes. This is great information, by the way. It's super information for people. You know, we need to listen to this stuff and adhere to it. Moving on to diabetes. How can you help yourself prevent a heart attack by lowering your sugar levels in your system?
So diabetes is a risk factor for heart disease, but unfortunately, it's not as simple as sugar causing the heart attacks and strokes. And actually, the sugar level does not correlate too well with the risk. Meaning, if you take medicine, and you should, to lower your sugar, it does not mean that you are lowering your risk for heart attack or stroke. It is a more complex mechanism. We believe more that the insulin resistance is the trigger for vascular damage and strokes and heart attack rather than just, the level of the sugar itself. As you may know, diabetes is fairly common. About 10% of the population is diabetic. 25% over 65 are diabetic. If you are diabetic, you should pay attention to other risk factors. So if you smoke, you should quit smoking. If you have cholesterol, even in the normal range, you should be on a statin. As we said, by guidelines, almost every diabetic should be taking a statin, with few exceptions, regardless of your cholesterol level.
Interesting. And of course, the heart healthy diet. This is give us some examples. And you talk about that sugar thing, and I heard Jeff Charles recently, who's just gone through all this cancer treatment, bless his heart, talking about. He was doing the interview on WITN the other night, just saying, sugar's just so bad for you. Is sugar good for you in any way other than making the stuff taste better? Sugar can just be one of the things that kills you, can't it?
Absolutely. Sugar, high sugar in the diet is really never good.
Yeah.
Now, when we talk about diet, we have to also include obesity and inactive lifestyle. Mm-hmm. So poor diet, obesity, inactive lifestyle are all a risk factor and a strong one for strokes and heart attacks. Losing weight can improve many things. It can improve your blood pressure, your sugar levels, your cholesterol levels, etc. So there are many diets that are out there that claim that they are heart healthy. I want to discuss two of them. One of them is the American Heart Association diet. And the recommendation in this diet is to keep your saturated fat intake, meaning red meat, dairy products, to less than 7% of your daily calories, to take at least 2 or more servings of fish per week, to keep your cholesterol to less than 300 milligrams, and most importantly, to limit very much your intake of what's called fatty acids, trans fatty acids. These are very malignant. Fortunately, they don't exist too much in nature, but they are man-made, and we add them to some foods to preserve them, to make them look better, last longer. And sometimes they are also used in deep frying because they can use it repeatedly without having to throw it away.
In a lot of Asian dishes. Yeah.
Yes, and I think some states have already banned the use of trans fatty acids in restaurants, and that's a good thing.
Is that how about MSG? Is that a trans fatty acid? No, that's a different animal.
Yeah, that's a different animal. Yeah. The other very popular diet that you may hear about is the Mediterranean diet, and actually, Mediterranean diet is a plant-based diet, meaning veggies, fruits, whole grains. Again, at least 2 servings of fish per week, specifically oily fish, salmon, halibut. And they also suggest that you replace the butter and the margarine with olive oil. So increase the olive oil in your... and again, lastly, increase the nut consumption. Nuts are felt to be protective. They increase the good cholesterol, and they also induce early satiety. So
I knew I was doing something right. I love nuts. What do you think about fish oil? Because, for a while, the craze was, protect your heart, take these fish oil tablets. And then, all of a sudden, just like many things, we found out, that could be bad for you. So what's your opinion now on fish oil tablets? Because I used to take those things like candy all the time.
So that's a good question. Actually, I'm going to lump this when I answer. under supplements. So there are so many patients who come who are very avert to taking real medications. Like they will not take a statin no matter what. But yet you look at their list and they have a long list of herbal, vitamins, fish oil, et cetera, And there's a long answer and there's a short answer to this. The short answer is supplements, including fish oil, do not prevent heart attack and do not reduce the risk of stroke. There isn't any study that showed that. Actually, there are studies that show otherwise. Now, people are under the impression that they do, and they may be under the false impression that there is no harm from taking supplements. Well, that's a false thing because, number one, these supplements are less regulated than real medications. And actually, there was a recent study a couple of years ago which showed that there are over 20,000 emergency room visits per year in this country that are related to side effects or adverse effects from supplements.
No kidding.
In addition, they are not free. They can be expensive, so save that money to buy the real drugs, to buy your statin, your blood pressure medicine, your diabetic medicine, etc.
Right. All right. Well, that's great stuff. I could talk to you for another hour about this stuff. This is stuff we all think about, but, you've given us great information today. Thank you for your time. Thank you for coming in. It's nice to meet you.
Thank you for having me.
Absolutely. Dr. Rony Shammas, who is the medical director of the cath lab here at Vidant Health here in Greenville. Good to meet you, sir.
Thank you.
Thank you for coming in.